Welcome to Daily Reddit, Ask Me Anything series. Today's episode. We are Dr. Eric Cioe-Peña, an emergency physician in New York, and Jayme Fraser and Adrianna Rodriguez, two USA Today reporters covering the coronavirus outbreak. Ask us anything. As coronavirus continues to spread throughout the US, we want to answer your questions. Ask us anything. Eric Cioe-Peña MD miles per hour is the director of global health and a practicing emergency physician at Northwell Health. He is a public health expert and has worked extensively across the world on public health efforts. Jayme Fraser is an investigative journalist for USA Today, focusing primarily on the Midwest and health. This year, one of her major projects digs into the accessibility of air travel for people with disabilities, both visible and invisible. When she's not reporting, she's watching soccer, crocheting beignets, or playing cards with a relative who is quarantined because her cancer makes her vulnerable to coronavirus and other diseases. For her most recent story, she worked with a colleague to analyze data from the American Hospital Association, US Census, CDC and World Health Organization, finding that US hospitals will run out of beds if coronavirus cases spike like seen in other countries. Adrianna Rodriguez is a health reporter for USA Today. She's been in close contact with infectious disease experts, doctors, and universities across the country to understand how the new coronavirus spreads and infects. These are two recent stories Adrianna has written. What does the coronavirus do to your body? Everything to know about the infection process. Children aren't at great risk for coronavirus, the report says, but some doctors aren't so sure. Proof: https://i.redpointed/4f39 nasixq86n41.jpg https://i.redpointed/u46sig4vm86n41.jpg https://i.redpointed/buoisk86n41.jpg. Can you address the topic of the USA being so far behind other countries with testing and preparedness? It's so hard to read through the bias of different news sources, and would love to hear some direct responses by the professionals themselves. The CDC initially chose to develop its own test separate from the World Health Organization. But soon after the tests were shipped in early February, there was a flaw in one of the test's components and states could not confirm the test results. This caused the initial delay. At that point only the CDC and the New York State Department of Health were testing. Now the government is allowing more and more private companies and commercial labs to test, and we are basically playing catch up, but the virus is just spreading too fast. How can social distancing and self-isolation possibly work when most Americans can't work from home and aren't being given leave or even proper PPE by their companies? People are already sick and still being allowed, even pressured to work with coughs and fevers. I agree this is a huge problem. We need the political leaders of our society need to step up and remove this obstacle. I work in MRI, and I'm currently working at a outpatient facility in PA, and I'm still scanning routine studies that are non-emergent. I'm getting little to no guidance on what I should be doing to protect myself or my patients. I have a few surgical masks. I feel bad for using a lot of wipes, because I feel all supplies should be taken to the hospital. Any advice for me? We are advising all of our clinical providers to wear surgical, procedural masks in the clinical areas and mask any patient that has a fever or cough. This is helpful in preventing healthcare workers from getting sick. Other than that, wash your hands compulsively between patients, definitely before touching your mask. To questions. My temperature is naturally lower than most people and I don't get fevers as badly. When I was sick with the flu I wasn't allowed to leave school early because I didn't have a fever. Is there any way that I could identify that I'm sick without a fever? Second question. What do you think about all schools in Ohio closing for 3 weeks because of coronavirus? 1. Aches and chills, difficulty breathing, dry cough and overall fatigue are also other markers. 2. Many states are following suit. Do you believe things will become so bad that doctors will really have to choose who lives and who dies when hospital resources become too scarce? I hope not. We need to take the public health measures seriously so we aren't put in this position. It's the worst thing in the world a doctor could have to do. I can't afford masks if I just put a piece of a t-shirt To cover my nose and mouth it would work. Unfortunately a t-shirt won't work. Honestly, masks are not necessary if you are healthy. They are helpful if you are sick and self-isolating. One surgical mask, which is not very expensive, your doctor might give you one if they are sending you home to self-isolate, could last you the entire 2 weeks in isolation. Are people with asthma at higher risk? Yes. However, children with asthma seem to be doing better than adults with asthma. If someone has been exposed to an individual with the virus, does the 14-day quarantine start after your last contact with them? What about people who are living with someone with this virus? At what point should their 14-day self-quarantine start? Correct. 14 days after last exposure. If you are living with someone with the virus, your quarantine starts 14 days after they are symptom and fever free for 24 hours. How much am I at risk as a 13-year-old if I test positive? I've heard it's about 1 in 4,000 deaths per cases in my age group. There have been no deaths under the age of 15. Do you think it will be possible for some states to fare far better than others? Like how in Europe certain countries are doing better. If some states take better measures. I'm in Madison, Wisconsin. Because no one has immunity, new virus, no vaccine, it is likely to end up everywhere. How many cases crop up in any given community or state will depend on the mitigation measures taken. That also will affect whether hospitals are hit with cases all at once and stretched thin. Because cities and states have been responding differently and at different times, I would expect there to be variances if we were to look back after a couple years. Community-wide measures help slow the spread. Social distancing, good hand washing and avoiding touching your face are the best personal protection measures. 1. How much toilet paper should we really be buying? 2. What is the best thing to do when your so has the coronavirus? 3. What would you do if you had the coronavirus? 1.TP, less than what we are currently buying. I would say 2 weeks worth, and that's a good rule of thumb for any groceries. 2. Keep your so in another room and limit contact. 3. If you have it, stay home. Is it true that recovered patients are having trouble with their lung capacity? I saw something about frosted glass lungs. I've also been seeing that people my age, early 20s-ish, aren't as low risk as everyone makes them out to be. What are your thoughts on that? Thanks. It's the ground glass appearance on CORD scan. It basically means that they have viral pneumonia and ARDS, acute respiratory distress syndrome. People can and do make a full recovery from that. Some people will have residual symptoms for weeks, but it does get better. There are sporadic cases of 30-year-olds and 20-year-olds not doing well. Most are doing great. Biggest risk seems to be a healthcare worker. I'm in New York City. How long until I can go back outside and do normal things? There's not much risk associated with being outside, going for a run, being in nature, etc. But other normal things like bars and gyms will most likely to be closed until at least April. Has there been any discussion on using drugs off-label that have shown promise in the literature as treatment for SARS and SARS-CoV-2, like chloroquine, remdesivir etc., on unstable patients, or as routine treatment in high-risk patients with COVID-19? Some doctors are using antivirals as a Hail Mary in hopes it slows down the progression of ARDS, acute respiratory distress syndrome. The results are being monitored, but it'll be a long time before anyone has certainty about whether they helped. Blanket guidance is a moving target with so much still uncertain about the virus. Ultimately, each doctor will have to make a judgment call. Is it true that children are more immune to the coronavirus? If so, why? They are not more immune per se, but they definitely are getting infected less and having much milder symptoms or no symptoms at all. They can still get infected and transmitted without symptoms though, so keep them away from grandma and grandpa if possible. It might be an uninformed question, for which I apologize, but is it possible for a young person 20 to 29 with a strong immune system to kill the virus from within, or would they just act as a vessel? The people who are infected but have no symptoms still have the virus in respiratory secretions, so they could spread it if they are slobbering all over things you touch, like a child might. There is no risk from sitting next to someone on the subway who has no symptoms, but people with mild symptoms, no matter how healthy they are more likely to spread the virus. Some initial studies show people with mild symptoms initially might not develop severe symptoms until week 2, if at all. If a person is tested for coronavirus and results come back negative, is it possible they have it, but are still in the incubation period, or does a negative test mean at that particular time they are clear? A negative result that day means you're not infectious, but you could have it. It's possible to test positive a couple days later. Hi, what estimate do you think is New York City's real infection rate? How many people do you turn away from getting tested due to limited testing? I think it's much higher than reported. Admittedly, all state and federal agencies are saying that too. We turn lots of people away from testing at this point, prioritizing in the EDS patients that need admission or ICU. If you can drive or walk yourself to a hospital emergency department right now, you probably should be going somewhere else. Compared to other diseases, like Ebola, for example, how dangerous is the coronavirus? Ebola is much more dangerous, about 50% to 90% fatal. Coronavirus at its worst is 7% fatal in Italy and will probably average about 0.6% fatal. Flu averages 0.1%, so a little more deadly than seasonal flu. There is a lot of confusing information regarding treatment in terms of diet and medication. What is the best way of home treatment in case I'm infected and I'm unable to be hospitalized due to the overwhelming stress in the hospitals? COVID-19 can lead to acute respiratory distress syndrome and, in the worst cases, organ failure. I personally would call your local health department, answer their questions, and follow any guidance they give you. If you have an underlying condition that affects your ability to be in a hospital, be sure to mention that. Your regular doctor and local public health officials will know best which resources are available where you live. Don't forget to like, share and subscribe for more.